Mononucleosis or mono is an infectious illness caused by the Epstein-Barr virus. Mono spreads through saliva, which is why it is sometimes called the kissing disease, but it also can spread through coughing, sneezing, or sharing utensils with someone who is infected. Mono is characterized by fatigue, fever, sore throat, and swollen lymph nodes, and these symptoms can last for weeks or even months in extreme cases. Rest, hydration, and over the counter medications for pain and fever can help manage the symptoms. There is no specific treatment for mono, and the virus typically resolves on its own. Preventing mono involves avoiding close contact with infected individuals, not sharing personal items, and practicing good hygiene, such as regular hand washing. Welcome back to another episode of Polymer E-Club's Ask Dr. Paul. Today we're going to highlight the thermoplastic processing technique, thermoforming. So when your boss talks about thin and thick gauge vacuum and pressure forming, what do you need to know? Thermoforming is a manufacturing process where a plastic sheet is extruded and heated to a pliable forming temperature, then formed to a specific shape in a mold, and later trimmed to create a usable product. It is common to reuse, regrind, or offal at 10 to 25%. Forming processes can be divided into two categories, namely thin and thick gauge thermoforming, based on the thickness of the plastic sheet. Thin gauge thermoforming is used for the production of disposable cups, containers, lids, trays, and clamshells utilizing sheets less than 1.5 millimeters thick. It is a cost-effective process for creating packaging and other lightweight components. Thick gauge thermoforming involves sheets that are 1.5 to 12.7 millimeters thick. This process is suitable for creating more robust products such as car doors, dash panels, refrigerator cabinet and door liners, and plastic pallets. Thick gauge products use pressure forming to achieve greater detail and part texture. Vacuum forming and pressure forming are two types of thermoforming, in which vacuum forming is the simplest method, where a vacuum draws a heated plastic sheet against the mold cavity to shape it. You can vacuum form over a male mold or into a female mold. Pressure forming, on the other hand, uses air pressure on one side of the tool along with vacuum on the other side to form the plastic sheet into complex designs such as undercuts with sharp details and textures. Common materials used in thermoforming include more amorphous applications than crystalline, since amorphous materials form well in a softened state. ABS is the most common plastic thermoformed and is known for its impact resistance and durability, making tray tables, seat backs, and armrests in airplane interiors. Polystyrene is used for disposable packaging due to its low cost, clarity, and rigidity. Polyethylene is used in a variety of applications, from containers to car parts, while polypropylene is often used in food packaging. When comparing the process temperatures of injection molding and thermoforming, the injection molding of thermoplastics happens at higher temperatures compared to thermoforming, as shown on your screen. And I have included processing temperatures of polystyrene, ABS, polypropylene, and polycarbonate. Thermoforming heats the plastic just above its softening point, allowing it to be stretched and formed, while injection molding involves higher temperatures, which softens and flows the plastic more like warm honey before injecting it into mold cavities. Thermoforming is a versatile process that plays a crucial role in various industries, creating custom shapes and designs using a range of materials. Knowing the thermoforming process and the thin and thick gauge products it produces, that's working knowledge. Remember to like, subscribe, turn on notification, and even share if you appreciate the content. You can visit our website to learn more about our upcoming polymer processing course. I'm Paul Nash for Polymer E-Club's Ask Dr. Paul. Thanks for watching.